Welcome everyone to Transparent Procurement for COVID-19, a conversation with implementers, the World Justice Project's session for the 2021 OECD Global Anti-Corruption and Integrity Forum. I'm Joe Haley, the Rule of Law Solutions Initiative Program Manager, ACLS Mellon Public Fellow at the World Justice Project. And I am extremely excited to have you all here today. Welcome. Today we're going to be talking about the importance of transparency and anti-corruption initiatives for procurement. And we've seen at the World Justice Project that from everyday protective equipment to complex medical devices, the rapid spread of COVID-19 has triggered massive government spending in support of patients, healthcare providers, and other essential workers around the world. So in this interactive discussion session, we'll be speaking with two local justice champions about their efforts to increase transparency in government procurement during the global pandemic in Honduras and in Italy. Our conversation will focus on practical recommendations and lessons learned over the past year. And we'll be thinking about how we can apply these lessons to the emerging challenges posed by national vaccination programs and other emerging threats and opportunities in the anti-corruption space. This virtual session is part of the World Justice Project's Rule of Law Solutions Initiative, which is a narrative research and reporting program. The World Justice Project is a knowledge partner of the virtual 2021 OECD Global Anti-Corruption and Integrity Forum. So with that, I'm going to introduce our speakers. We're incredibly fortunate to have with us today two amazing justice champions who are representing organizations that are finalists in the 2021 World Justice Challenge. We have with us first Andrea Nelson Mauro, project manager and data journalist at OnData in Italy. Andrea Nelson is an Italian journalist and an expert in data journalism and open data. He is co-founder of OnData, which is an Italian nonprofit association that promotes the opening of public data to make it accessible to all. OnData's Appalti-Pop project is a finalist in the World Justice Project's 2021 World Justice Challenge. And also with us today, we have Dr. Kurt Verbeek, who is the president of the Asociación para una Sociedad más Justa in Honduras. Dr. Verbeek is a Honduran civil society, is president of this Honduran civil society organization dedicated to combating corruption and violence and making public systems work for the most vulnerable. For over 20 years, Dr. Verbeek taught as a professor of sociology at Calvin University, where he co-directed the Justice Studies semester in Honduras. He has a PhD in development sociology from Cornell University, and he is the author of Call for Justice, a book about the theory and practice of justice co-written with philosopher Nicholas Wolterstorff. Did I get that correct? ASJ's Constructing Transparency, Promoting Justice in Honduras Through Good Governance and Strong Public Management project is a finalist in the World Justice Project's 2021 World Justice Challenge. And we'll be speaking a little bit more about the Justice Challenge at the end of this call and give you an opportunity to connect with some online resources that the World Justice Project has developed if you'd like to learn more and connect more deeply with our finalists and with Dr. Verbeek and Mr. Mauro. With that, I'm going to turn it over to our speakers, but I would like to just flag two technical concerns to bring to your attention regarding this call. First is that the call is being recorded. So if you are concerned about your messages being on the public record, please keep that in mind. And we will plan to release this recording subsequently to the call in the future. And the second is that we have a Q&A ongoing in our chat function. So if you have any questions for Dr. Verbeek and Mr. Mauro, please share those in the Q&A. We have World Justice Project intern Sally Aldrich, who is going to be monitoring the Q&A and gathering some questions for us to address. And this really is intended to be a very interactive meeting and for us to hear your questions and address your concerns and to give you as much opportunity as possible to interact with our speakers. So with that, I'll turn it over first to Dr. Kurt Beek, who will tell us a little bit more about ASJ's work in Honduras. Please take it away.
Thank you very much, Joe. And it's an honor to be here with both Mauro from Italy, but also to have a chance to be a part of the finalists for the World Justice Project. So thank you all very much. As Joe said, my name is Kurt Beek. I'm a board member for ASJ. ASJ is a Honduran civil society organization, and our mission is to make the state work for the most vulnerable. We focus on violence and corruption, especially corruption in education and health. And today I want to talk a little bit about our work in corruption and health, especially our work around the COVID. I'm mostly here because I'm an English speaker, but we have a staff of over 80 brave Hondurans trying to create a more just society, trying to make the state work for the vulnerable. 80% of the Honduran population is in poverty, and that same 80% then use only the public health system. The middle and upper class mostly use private health care. So over the last 10 years, we have investigated corruption in the health sector, especially medicine purchasing and corrupt hiring practices. And our investigations have been front page news, people have been in jail, others have been fired. And we're always trying to make the public health care system work. And we have seen some big changes, especially in medicine purchasing. So when COVID hit in March, the government approved about $200 million for purchasing. And they asked ASJ if we would be willing to monitor and audit those funds. And we agreed, and we started reviewing purchases, most of which they had already made, which was a problem. Or others that were in the last phases. And so we were monitoring COVID testing, the purchase of ventilators, masks, almost $50 million for the purchase of 7 mobile hospitals. And so to do this, we set up 4 teams. We had 3 teams here in Honduras and 1 in the US. Our team in the US was quoting similar products and arrival dates in the US. So we wanted to see how much the US was paying for these products and how soon they would arrive if you ordered them in the US. And we were talking to experts there about the quality of the products that Honduras was purchasing. But we also had 3 teams here in Honduras. We had 1 team of health experts looking at the quality of their products, but also how they would fit into the Honduran health system. The second team was looking at price and comparing the price Honduras was paying to the price we were getting quotes for. Arrival dates, how soon would they be arriving? And our third team was reviewing the documents the Honduran government gave us to make sure it was an efficient, effective, and legal purchasing process. And as you can see in the next picture, our third team was also investigating the quality of the companies the government was buying from. So we wanted to make sure that they were real companies that existed, had experience, and weren't fraudulent sales or political patronage. So members of our team, in the end, also reviewed shipments upon arrival to make sure that when the products arrived, they were what had been promised. We have so far published 8 reports. We've had multiple press conferences. One of our press conferences has been viewed over 23,000 times and been mentioned in 46 different media outlets in Honduras and around the world. I want to just share 2 examples of our findings. First of all, we discovered that the company selling the 7 mobile hospitals for $50 million was a storefront in Fort Lauderdale in a little strip mall, and they had never sold a mobile hospital before. We found out that the CEO was buying them from a company in Turkey. And when we actually quoted the hospitals directly with the same company in Turkey, they gave us a quote for $12 million less, for $38 million, when the Honduran government was paying $50. And that was without any negotiation. I'm sure we could have gotten them cheaper. So Honduran health experts also argued that they could have built extra wings on the IC units for less money and quicker than what the government was waiting and how much they were spending. The hospitals ended up arriving months later than they were promised. There was lots of problems, and to date, only 2 of the 7 are functioning a year after they were purchased. And the Honduran ICUs are currently bursting at the seams. Let me give you one more example. We also documented that Honduras bought 250,000 COVID tests. Now, these were bought from a very well-respected company in Korea, and they actually got a very good price for them. But no one bought or even asked what was necessary besides the test kit. So Honduras had no swabs for taking the examples, nor the chemicals or equipments necessary to process the tests. So for several months, they sat in storage. And in the end, we discovered that they had been taken out of refrigerated storage and all of them were useless, which meant for months, Honduras had almost no COVID tests. So our reports made front page news for weeks. They still do. It's continuing to have impact. Multiple officials have resigned. 2 minister level officials are awaiting trial. And in the end, the government asked the United Nations to take over all COVID purchasing to make sure Hondurans get the products they need at a fair price. And that's, in the end, what we want. We were sad and angry by what we discovered, and the population was equally or more so. But we're also proud of the work we've done. And what we did has become a clear deterrent for future corruption, and in the end, forced the government to take steps to improve purchasing, including inviting in the United Nations. In our COVID work and our commitment to create a more just society and a better health system is not over. We've just launched our effort to monitor, investigate the COVID-19 vaccination process. In fact, we have a press conference in about 2 hours, but we are also investigating the process of purchasing these, the vaccines, both the price, the quality, and transparency of the process, much like we did in the past. Honduras has just received last week its first 50,000 vaccines. So Honduras has a population of 10 million and so far has only received 50,000 vaccines. But we have dozens of volunteers around the country monitoring to make sure that the right people are getting vaccines with proper protocols. So thank you very much. It's a little what we've done, and look forward to answering some questions.
Thank you so much for that. I mean, it's fascinating and really inspiring work. And I think, you know, there are some really challenging details in what you're saying that I would love to explore a little bit more. In particular, I think we should come back to the question of vaccines a little later in the conversation, because you know, it sounds like the government is really going to have to ramp that up a lot in order to meet the need. And so thinking about how you might apply the lessons learned from this initial phase of the pandemic to those vaccines, I think will be really important. And I'm also really interested in kind of the array of solutions that have been developed in partnership with other organizations. So you mentioned that UNOPS has taken over purchasing, that there are civil society organizations working to advocate an integral health plan, and that there's been an improvement in compliance. And I think that raises some really interesting questions about, you know, partnerships, and also about how we measure success, how we think about compliance. So we might circle back to some of those. But thank you so much for that wonderful introduction. With that, I'd like to turn to our second speaker, Andrea Nelson Mauro, who is representing OnData, and will tell us a little bit about the project Appalti-Pop and other efforts that OnData has engaged in order to increase transparency in Italy.
Okay, thanks, Joe. Thanks, everyone. I'm very happy to be here with you. Thanks for having me. Let me share my screen. I think you can see my screen now. I'm reaching out from Italy. I'm based in Milan, and I'm representing here OnData. That is an Italian civil society organization born a few years ago. Definitely, we work to open up data and make it accessible for everyone. And this is the only mission we have since we were born. OnData is based in Sicily. The headquarters is in Sicily, but we work with a network of volunteers all around our country. And among our volunteers, we have journalists, we have civil servants, and public employees, and civil and activists at large. So we have a strong need of transparency and more openness about public information. This need is a kind of sentiment from a different kind of people. So this is the reason, because we definitely are we are working with a strong interest from a large target of Italian populations. We try, since the organization was born in 2015, we try to carry out projects focused on technological part of activities, and to try to promote citizenship, participation, and transparency, and a kind of safe use of internet instruments. And we try to use open source software and technologies, promoting open data methodologies, and creating participatory processes online. Just to give you a quick overview on what we did so far, you can see on my screen 3 different initiatives that we carried out in the past. The first one is called the Confiscati Bene. That literally means goods confiscated, seized from mafia or organized crime. We have tried to map it and expose it for public usage by citizens. The second one is a Paltipop, that literally means opening up the public registry of information from different public institutions. The third one is Ricostruzione Trasparente, that literally means transparent recovery after the earthquake in the central Italy that you probably already heard since a few years ago. We are here, we are applied to the World Justice Challenge with our new project, the new platform that is called the Paltipop. Definitely, it refers to a process to opening up data about public contracts and public procurement in Italy, and introducing a standard methodology to publish and release data that is called OCDS, Open Contracting Data Standard, a common and global standard to make data interoperable among different nations, among different authorities across the world. This project tries to expose this data and make it comparable in order to assess what kind of differences you can find among methodologies of tendering processes, methodology of relationship between buyers and suppliers. So this is a very interesting project in terms of comparing what can happen in different parts of our countries. But here I would share with you a new initiative that we have launched in the past few months, mostly focused on the pandemic. You may consider that we are one of the few Italian organizations with technological expertise focused on the field of data and in the field of addressing public institutions to open up data. And we decided to launch a special project for the COVID pandemic, not only focused on public procurement, but about all data about the pandemic in Italy. This project is called Dati Bene Comune, literally data common goods. and we gathered 50,000 signatures since the beginning of this campaign from Italian citizens, and with endorsements by 170 organizations from very different kind of organization, from TV shows to other NGOs to public institutions like the National Research Council, to ask the government to open up data. Because one of the most important problems that we have at the moment in Italy is this process of the need to improve the awareness of government to what does it mean open up data. So for instance, today the actual Prime Minister, Mario Draghi, told to the Parliament that he will open up data about regions, but this data is already open. So we are in a kind of way that where politicians are not aware about what it happens in other part of the public institutions. How we can give a support to this process with a participatory model, a collaborative approach. So after collecting signatures and gathering support from this huge amount of citizens, we are trying to create a kind of common ways, common methodologies to interact with citizens. So for instance, in my screen, you can see a collaborative digital space that some of you probably knows, that is Slack, where we have gathered all interested citizens to give us some support in asking data, in giving support under the regulation and so on. So we try to work with citizens at large and to give more impact to our actions. To finish my introduction, what about impact? The state of the art is very interesting for us because a lot of Italian newspapers are using the data made free from OnData. In my screen, you may see a page, an article from the Sole 24 Ore. It is a kind of Italian Financial Times, but it's not the only one. So data can be a kind of fuel to help journalists and citizens at large in doing their work. Two aspects that I want to share with you to close my introduction are two recommendations for the public institutions. The first is to open up data and trust citizens and everyone involved about the use of this data. The second one is working with civil society, because public is, I think, we strongly believe that public institutions can learn a lot from civil society organization, also to understand what is the feeling, what is the citizenship feeling, what can be the new way to empower a collaborative model and processes between government and citizens. And thank you.
Joe, sorry, I'm jumping in. We can't hear you right now.
I think I'm, is it better now?
Yeah.
Yes, we can hear you.
Great. Yeah. Thank you so much for that amazing introduction. We're really excited to learn more about these various kind of open data, open contracting initiatives that you've undertaken. I'm particularly interested to hear more about this process of generating red flags within a Poltipop. I think that's really an interesting feature. And also some of the open data standards that you're using. If you could say a little bit more about some of those partnerships, I think that would be really useful for our audience. And then just the impact, this sort of theory of impact with journalism in Italy. I think it could be interesting to hear a little bit more about the specific situation that it is that obtains in Italy for the access to government data, and also the situation that the media environment is in Italy, because I know there's been a kind of really interesting history there around the government's relationship to the media, and so it would be interesting to hear your thoughts on that. But first, I'd like to, while you mull that over, I'd like to circle back to ASJ, to Kurt, and to ask if you could just say a little bit more about the theory of change that is operating in your programs in Honduras, and if you could speak a little bit to where Honduras was at prior to the pandemic, and how the pandemic has kind of changed the situation when it comes to government corruption or procurement. Obviously, it's been a big challenge in a number of countries, but I'm wondering if you can give us just a little bit more context about Honduras in particular. Is this a situation where an already quite corrupt set of institutions has become more corrupt, or is this really just a situation where the government processes are overwhelmed, and so there are new frontiers of corruption? Is it somewhat of both? How would you frame what this kind of historical pandemic means for the larger fight against corruption in Honduras?
It seems to me that not just Honduras, maybe even all around the world, because I think we're seeing similar things in US and Europe, that the pandemic has exposed the injustices and the inequalities that were always there in new ways and in disturbing ways. So I think when you see the inequality and who's getting the shots, Honduras has 50,000 shots for 10 million people, versus the US is, I think, now at over 25% of the population has received at least one shot. The same is true here in Honduras with purchasing in general, where purchasing has always been a problem. We actually had seen some limited improvements, successes. For example, in medicine purchasing, we were able to get significant improvements, but COVID, both the urgency of it, the competitiveness of the purchasing, and the large amounts of money that were being thrown at this made corruption both more possible for those who wanted to do it, but also more likely, because having to make quick decisions with companies that you weren't familiar with, and oftentimes the companies having control of determining what information they would give you and what they wouldn't. So I don't think COVID made the situation here or in other countries, from what I can see, a lot worse, but it exposed lots of the problems that were already there.
That's really useful. That's really interesting. And I'm struck by also your example about the Shell company in Fort Lauderdale and how that was a component of it. So I'm wondering if part of that story isn't also an exposure of kind of a weakness or someone being asleep at the wheel in international kind of anti-corruption watchdogs. You know, were there systems that should have prevented that, that just kind of failed to do so, or is this just really a case of lack of oversight on the Honduran government's part, or is it more of an international story there?
It was clearly lack of oversight on the Honduran side. So their pictures came out later that this CEO of this company had made multiple trips to Honduras trying to sell them other things. So they had pictures of him with different government authorities where he wasn't selling mobile hospitals. So it seemed to be a sort of a hanger-on who was looking for an opportunity to make a deal with government, and probably a sweetheart deal where there would be kickbacks for him and for the government authorities. And they seemed very decided to purchase from this company despite a lack of other options, without exploring with government authorities how much it would cost to build extra wings on ICUs, how quickly could they do that, what the pros and cons were of these mobile hospitals versus those. At the same time, I don't think Honduras is alone in this, right? So I have read recently that Amazon has worked very hard to keep false N95 masks off of their website. The US also has overpaid for lots of products that they were buying early on in the administration. So again, I think this pandemic exposes problems in Honduras, in the US, and other places. Right now, Europe is fighting over should they ship vaccines from one country to another. So I don't think it's only in Honduras, but countries like Honduras are much more vulnerable, much weaker institutions, and that's what we've been working on, and we're going to continue working on.
Great, thank you for that. I mean, and it does sound like that systems approach that I think was represented in your answer has also been baked into the theory of change at ASJ. It seems like there's a level at which your efforts are aimed at big international or intergovernmental organizations, and then seems like you're working locally with civil society, and then you're also collaborating with the government where that's possible. So it seems like a multi-stakeholder approach. I'm wondering if you could speak to that at all in your theory of change and to the importance of having buy-in from these different stakeholders. And are there perhaps particular catalysts or stakeholders who were important to your early success in this that we might be surprised to hear that this was a kind of key player? Was it perhaps an agency or we like to think about islands of integrity, people who you're working with in the government, for example. What has really been helpful in order to move that multi-stakeholder approach forward?
So yeah, great question, Joe. I mean, I think our goal is different than some organizations. And our goal is not to denounce or to find the corruption scandals and make them public. We often do that, but that's not our end. Our end is to make the public systems work for the most vulnerable. And it's an advantage here in Honduras because if people have money, they send their kids to private schools, private hospitals. If they're poor, the 80% who are poor all use the pub. So if we can get the public system working, it's going to benefit poor people. And in order to do that, we have to make those public institutions work. So our theory of change, we always start with really trying to do really good investigations, really good research, like what is broken and what is working, because oftentimes it's surprising, like you said, some things are working or maybe better than you thought, or there's really good people in the system, but they're not being listened to. And once we have those investigations, once we usually almost always find some things that are very broken, we make that all public. And we usually name names. And that's what gets attention. So we have a very good relationship with the press. They love our press conferences. They love the $50 million mobile hospitals that should have cost 38. That's the stuff they sell papers on. But then what's I think sometimes different, and again, a key piece is that that's not our end. We're willing to help fix things. So we're willing to come alongside of the government and figure out what can we do to help. And so we have experts in purchasing who expose the problem, but those experts in purchasing are willing to come alongside the government and figure out how to fix the system so this doesn't happen again. And then we go back again and investigate again. What's still broken? What didn't we fix? And we start over again. So I think maybe I'll highlight a few things. The really good research, often with partners, access to the press, making things public, which is often scary. We've gotten lots of death threats. One of our lawyers was killed, but we're also willing to help. We don't just throw stones. And that has gained us an openness from the government to work with us that other institutions don't have, that we try and be objective and helpful, not just destructive. And then we just keep going back to those same topics year after year. We also don't jump around from topic to topic. we just stick with these topics year after year. We've been working on purchasing and human resources for over 10 years.
Great. That's all very useful. Thank you so much. And I'm seeing a lot of activity in the chat, so I do want to give as much time for the audience to interact with you as possible, but I'll just ask one sort of follow-up question to you, Andrea Nelson. So obviously the context in Italy is quite different, but there are some kind of thematic echoes that we might think about in terms of government partnerships and media partnerships. And you're approaching this as a very data-focused organization, which is very kind of near and dear to our hearts at WJP as a data-focused organization as well. I'm curious, how you think of this pandemic. Is it a historic opportunity for the open data space? Is it primarily a challenge? Where is Italy in terms of dealing with these issues? Where would you focus efforts at this point in Italian history?
Yes, first of all, I would highlight that I totally agree with Mr. Verbeek in terms of approaching to establishing and running organizations like us, because you need to focus on specific topics, and you can improve your expertise in doing day by day better what you are doing, let me say. As for the Italian state of the art, I would share 2 points of view for this debate. The first is related to the open data movement that, it was born something like 10 or 15 years ago, when Sir Tim Berners-Lee promoted for the first time the open data about 5 stars, the different levels of opening up data about public institutions, but at large, also for private institutions. So in Italy, we are talking about open data since 10 or 15 years. Since the first days of this debate, a lot of things changed. And now we think that a lot of awareness has been improved also in the public institution, in the mindset of citizens. But COVID-19 pandemic gave such a boost, incredible boost to the needs of data. So this is a very important factor in the mind of us, of citizens, as citizens. So today we need, for instance, I'm based in Milan, and we in Italy, we manage the various lockdown under different criteria based on the number of positive people under 100,000 citizens. So I know that if this threshold is less than the defined one, I can go out and go to with my family. If this threshold is up to the level, provider level, I have to stay at my home. So I need this data. I absolutely need this data to know what I can do tomorrow with my family, with my work. So this is a very changing factor because the data can drive me to my decision in everything I do every day. This is at large about the pandemic at large, the outbreak at large. But referring to the topic of public procurement, you may consider that every year in Italy, Italy spends 150 billion euros in public procurement. And we are talking about 6 or 7 million tenders per year. So a very huge amount. We are working with the National Authority, Anti-Corruption Authority, and they are managing a database with 60 to 70 million tenders. So this is there are a lot of data, and very different and very difficult to be analyzed, to be understood, to be meshed up. So our approach is to make people capable to access this data. make the number of people that can access this data, the higher one, the higher as we match, because it is impossible for a single authority, anti-corruption authority, to analyze such an amount of this data. It's very incredible it's very awful, the volume of this data. So if you are if you have to cope with 60 or 70 million standards, is very incredible number. It is impossible to understand.
Right. Yeah. That's something that resonates with our experience, even in the US, where we're saying, you know, people are becoming armchair statisticians and armchair data scientists as a result of just how much information is being produced, and it's certainly become a necessary part of daily life to making informed decisions here. I do, though, want to acknowledge a challenging question that I think is relevant to this from our audience. So Roberto asks, he says, empirical evidence shows that transparency measures, such as open data and access to information laws, do not automatically deliver the desired outcomes of reduced corruption and stronger integrity. So he wants to know, in your experience, what are key conditions or assumptions that are necessary for transparency measures to be effective? So what are some of those enabling conditions that allow open data and transparency to function? You've mentioned, you know, obviously the government needs to provide the data. I mean, Freedom of Information Act requests can be denied, things of that nature. The data needs to be in an accessible format. But beyond those kind of basic technical requirements, are there other pieces that have to be in place in order for open data to lead to outcomes that we really want to see in the anti-corruption space?
So on one hand, I think that as an important need is the standardization of data. So in order to make it comparable between different institutions, so we need data, but in a right way. But I'm confident with the expectancies of public institutions, because we were in touch with a lot of Italian institutions, so we know that there are a lot of civil servants trustable and open to collaborate with citizens. So for instance, we have a Freedom of Information Act, and people is using this Freedom of Information Act to access this data, and the civil servants in most cases are happy to create this kind of bridge between questions by citizens and answers by public institutions. But I think that we have two contextual limits. The first one is in terms of a skill shortage that we have at any level. Dealing with data is very hard for the ones that are not aware, that are qualified to manage data, to analyze, for the ones that not know the domain and so on. So this is the first one. The second one is in terms of civil society organization that in Italy are specifically traditionals. So for instance, no one of the civil society organization that we work, which we work with, have technicians among their employees. So this is a field of an opportunity for us to team up with others. And you know, in our application we shared a list of some of the organization we teamed up in this month. But it is a problem for them, because if you don't have any technician expertise in your organization, you cannot deal with data. So the problem, as we are a little organization, we can help from in some points with, in some cases, these bigger ones. But they need to engage, to involve employees with technicians, technical experiences in their daily workflow, and they do not at the moment. I think that that kind of skill shortage in terms of maybe citizens in dealing with data, but also in terms of capacity of civil society organization.
That's great. That's really helpful. And just a quick follow up to that: who is actually responsible for administering and enforcing those freedom of information laws in Italy? Is it the particular agency?
We have two. We have a department under the Prime Minister offices. That is called, the name is literally Funzione Pubblica, that is because of public function. So it's a kind of department of public function that depends from the Prime Minister. This is on one end. But on the other end, we have also a Ministry of Digital Transformation. This ministry was born, the office was born 2 years ago. So there's a very changing phase in Italy. So before the ministry, before the beginning of this Ministry of Digital Transformation, all these functions were in charge of the Department of Public Function. But in the last 2 years, with this new Ministry of Digital Transformation, there are more effort of the Italian government to try to provide open data and digital services for citizens. The FOIA, the Freedom of Information Act, is in charge of single public authorities. So for instance, if I want to access data from the municipality of Milan or Palermo, I have to ask specifically to this municipality, and I have a process, well-done process, because I can ask for this data to a single officer, and I can give a second question to another officer that can control the first one. I have a kind of a third degree of control, because 3 is the perfect number, you know, as we are in the Dante board date.
Right.
3 is the perfect number. I have the third degree level of for asking this data. So the process is very complicated, let me say, but each citizen is guaranteed in
right. It sounds like that. Yeah, it sounds like quite a complicated process, and it sounds like precisely the kind of learning that would be wonderful to bring to our community forum to share with other civil society organizations in Italy or even around the world who are dealing with freedom of information type issues. I think that that's something that our audience there would be really interested to hear. Most of the questions that we're getting at this point are really interested in drilling down on the question of collaboration. And there's a specific question from our own Ted Picone, Kurt, to you about who some of your kind of key or most reliable partners have been in the Honduran government.
Key and reliable are not necessarily the same thing. So I think we have now 10 plus years been working on, I would say, 4 key topics. One is education, health, security, so the police and justice system, and 4th, just corruption in general. So I think the key players then are fairly obvious, right? We have in Honduras, they're called ministers, but the Minister of Education, Minister of Health, Minister of Security, and the structures underneath each of them. So, so I think they're all keys. Lots of them over the last 10 years have been more reliable than others. I think our relationship is always somewhat tense because they know on the one side that we will be doing investigations, and we will say, so one of the things we have done is every year and a half, every 18 months, rated their follow through on the law for purchasing. So how well do they follow the law in purchasing, and how well in human resources? And we first did that probably 8 years ago. And each of these ministries were scoring in the 20s. Like, they were only fulfilling 20% of what the law required them. And we did a public event where they had to sit up on a podium with Carlos Hernandez, the executive director of ASJ, and Carlos explained why they had failed to do 70-some% of what the law required and were only doing 20%. Very humiliating process, but we got all of, through different sorts of pressure, got all of the ministers to actually do that. And then over time, most of them are now in the 50s and 60s. So they have improved their purchasing human resources, but it's still not great. Like they would still get an F in most US schools. So it's a tense relationship. At the same time, they know if they work with us, we will help them. If they improve things and things are being positive, we will tell them that. And also we have lots of access to the press to either share things that are not going well or are going well. So I think, yes, those are the key people, and most of them we have continued to have an open relationship. We always say we need to be respected. We don't need to be friends.
Yeah, that makes sense. I am interested in, so Ted specifically highlighted Congress, the judiciary, and local mayors. I'm curious if any of those kind of subnational actors have been involved in an important way.
So we worked much more with the executive branch, again, because of our focus. With Congress, we have worked to a limited extent, and I think there's a couple of people in our staff who would love to see us do more, and just it's a matter of funding and ability, time. We do work with mayors, mostly the Association of Mayors. They are very involved in education and health. They're people who care a lot about that. So the National Association of Mayors is a regular ally of ours. And with the judiciary, so we work a lot more with the police, but also with the Attorney General and with the judicial branch. And we have quite a big program right now with the judicial branch doing training. We call it, so it's Modelo de Gestión in Spanish, but it's a case management process. That's the idea, which will be giving them much better ability to track results. Like, are the judges producing more results and better quality results? So again, that's always our focus. How do we get the government to produce more and better results? And that's what we're doing with both the Attorney General and the judicial branch. And so far, I'll just give you one little stat. So we tried this with 18 judges in Tegucigalpa, and we brought the average time that a case, so these were minor crimes like robbery, things like that, the time that a trial took from the beginning of the arrest until the trial was finished went from almost 2 years down to 3 months. So that's the sort of stuff that we've seen. It is possible. Judges like that, the police like that, the jails like that, that's good for everybody.
Great, thank you for that.
Mostly it was moving from a written systems where everything had to be written out by judges and their secretaries to using video and audio, and that was an official form that the judges could use, and it didn't need to all be transcribed, and that just saved months of time.
Right. Thank you for that. And it does, I think, helpfully pivot back to the question of technology and digitization. And I want to be mindful of our time. We have just 7 minutes left, and I want to give you each a closing thought. But we do have a question from Arnisa that Andrea Nelson, perhaps you could address just in 2 minutes or less, which is whether there are any trustworthy databases to monitor public procurement from the business perspective in particular. Like how do you approach monitoring businesses?
I think that the good answer would be that we have different services in Italy, carried out by companies or such as, for instance, contrattipubblici.org. I can share with you the website. and you can buy an access to these digital services and try to monitor the process. The monitoring process has a huge problem so far, because the red flagging process of procurement is not so, at least from my point of view, Italian point of view, is not so easy to be done, because there are different factors to monitor the public procurement at different level. For coping with this problem, as we are only technical expertise, we are teaming up with the universities, with some researchers, in order to assess the way we are red flagging data, because we have and we will not have enough expertise to carry out this process. So we will try to improve the way we are red flagging the data with the help of researchers. As for companies, I have not a specific answer on this. I think that there is a 1.0 way to monitor data for companies, so all services, and because we are talking about new data. So, for instance, the National Authority Against Corruption, Italian National Authority Against Corruption, released their open data portal last October. So we are at very early phase of this process. So
right. Thank you for that. So it sounds like, I think that's a good note to end on. That there's a lot more to look forward to, and perhaps integrating business data could be a future line of work for OnData. It sounds great. 1 minute or less. Kurt, do you have a final thought, particularly for other practitioners who may be interested in learning from your experience of the last year?
I think I want to end with a message of hope. So lots of times this sort of work can make you cynical and depressed. And I think doing this sort of work, doing really good research, making that public, like 2 examples, for 5 years, we were saying the police needed to be purged in Honduras. And finally, they invited us to be part of it. And we ended up helping to get 6,000 out of 13,000 police fired. We found out that kids were supposed to be getting 200 days of school, and Honduran public school kids were only getting 120. And over the next 2 years, we were able to get the average back up over 200 days of school for all the public school kids in the country. Both of those things have since started to backslide, but big changes are possible. This sort of work is often hard and a little depressing, but it also can work. And I hope more join us here in Honduras and elsewhere.
Fabulous. Thank you. Well, that's pretty much our time. I do want to invite everyone, however, to continue the conversation on the newly launched World Justice Challenge Community Forum, where you can interact with both OnData and ASJ. In addition to all of our other finalists and semi-finalists from the World Justice Challenge, there are a lot of really great people, justice champions around the world who are working on access to justice, who are working on anti-corruption and open data, fundamental rights, and accountable governance, right? So we have a wide variety of implementers. I'm just going to share my screen really quickly if I can. Let me see if I can figure this out in 1 minute or less. Yes, here we go. So if you see here, this is community.worldjusticeproject.org. It's sort of a community forum, so you can join. The more you interact, the more privileges you'll be granted in the community. You can post topics, questions, engage with folks. We're already starting really interesting conversations around these different programs. So there's a lot to learn there. We'll be posting resources and links on our website to future rule of law solutions activities, and those will be live on the community forum as well. So please do join us at community.worldjusticeproject.org. And I would always be remiss if I didn't mention the Rule of Law Index, data.worldjusticeproject.org, where you can also find lots more information about rule of law challenges in Honduras, Italy, and over 100 countries around the world. So thank you all so much for your time today and your attention. Let's continue the conversation offline. Thank you again. And we're always happy to hear great stories from justice champions around the world. And you guys were phenomenal examples of that. So thank you for the inspiring and informative talk. All right, everyone, have a great afternoon. Be well.
Bye-bye.